This gentleman has a Chiari malformation with chronic migraine and many other symptoms. It was operated in 2021 with a dramatic improvement, about 90%, in his overall symptomatology. Nonetheless, he had vestibular migraine, daily migraine headache. He still had tinnitus, fullness in both ears, light sensitivity, facial flushing, and chronic nasal congestion. He has had a rather impressive response to propranolol, initially at 120 milligrams, and we increased it to 160 milligrams with near elimination now of his dizziness, complete elimination of the facial flushing, ear fullness, and his tinnitus as well. But he is still very sensitive to light. As you can see, we're sitting here without the office lights on. It's a big problem for him because of the LED lit workspaces, which are increasingly common now. He's tried blue light filtering glasses with no success. We're going to increase his propranolol to the maximum dose. He does have rhinitis, and it's so severe that he uses Vicks rub on his upper lip about 3 times a day. He's not addicted to it though. If he has a dry day, he doesn't need it, indicating that he is not in a state of what we call rhinitis medicamentosa, where you get hooked on nasal sprays and decongestants. So we're going to increase his propranolol, and if that isn't successful in eliminating the residual symptoms, we're going to add nortriptyline. It has anticholinergic activity, which can help decrease some of the swelling in the nose, but also acts very synergistically with the propranolol. And I'd like him to tell us about his symptoms before his surgery, after the surgery, and then finally after treatment.
Before my surgery for Chiari malformation, I felt dizzy, whether it was nice weather, cold weather, hot weather, raining, no matter what the climate was. I felt really dizzy and unbalanced, with a lot of pain behind my eyes and balance issues. After the decompression surgery, I would say those symptoms have gotten 90% better, and are more controlled off of certain environments. Paying close attention to how the weather is and foods that I consume, or just the day-to-day activities helps control those from happening. I did get with Dr. Teixeira, and we have tried the propranolol, and it has significantly helped with my breathing, with my balance, with my ear ringing, tinnitus, and the really bad facial flushing I would get from time to time. All of these things would happen at once and kind of become overwhelming, and it would consume my day. Things have gotten dramatically better. Still having issues with the breathing in high humidity environments, which is why I'm using the Vicks rub under my nose and nose strips, which seem to help, but I would like to get to the point where we can control it with medicine and I could have a normal day in high humidity environments.
Thanks. I think we're going to get there too, because your migraine has a strong element of dysautonomia, meaning that your autonomic nervous system is out of balance, and in specific terms, you have a high amount of parasympathetic activity, and that's what this nortriptyline may help, and we'll go to that if the propranolol alone doesn't do it. We always try to fix things with a single medicine, but a combination sometimes is necessary. Thank you for sharing your story. I think a lot of other people have similar symptoms that their doctors aren't addressing because they don't recognize them as possibly connected to their chronic migraine.
Thank you.